with this particular psychiatrist, and I've heard this happen with other people too, that I think that she sort of knew that the diagnosis would make me happy and
hmm
was more inclined to confirm
hmm
it. And I think, like, kind of the sign of a good clinician, a good doctor, is to look for alternative explanations and to, look for disconfirming evidence and to really carefully uh, evaluate.
My friends, let us consider that acuity is the refined clarity of thought and perception which enables one to discern subtle truths. This week, Dr. Lavranos and Amy Hamm are joined by special guest and investigative journalist Christina Buttons. Christina is an investigative journalist with the Manhattan Institute. She often covers gender ideology and trans madness, as well as mental health, youth culture, and immigration. Last month, Christina wrote a fascinating free press article titled, "I Thought I Was Autistic. I Was Wrong."
Hi, everyone, and welcome to this week's episode of the Acuity Podcast, Politics and Culture. I'm your host, Dr. Aris, the CEO and Chief Litigator at Acuity Medical Law, and with me, as always, my co-host, our Communications Manager, Nurse Amy Hamm. And we are very lucky this week to be hosting a wonderful interview with Christina Buttons. As our intro discussed, she's widely regarded for her work in the transgender, gender-affirming care conversation, and most recently made a big splash with an article discussing about her journey through being diagnosed and coming to terms with the lack of diagnosis of autism. So we're very happy to talk to you today, Christina, and ask you for some of your insights on sort of the medical industrial complex at large and what you think is sort of underpinning all of those kinds of things. So I will let Amy start us off.
Yeah, maybe what I'll do is I'll read a little blurb from your article, it was so fascinating and excellent. And then I'll let you jump into where you're at right now. So you wrote, "I never had a good explanation for why so much in my life had gone wrong, but the residual effects of this turmoil followed me into adulthood, making it easier to retreat into a kind of comforting solitude. Then, as an adult, seemingly out of the blue, I began encountering stories along a similar theme. Women discovering later in life that they were autistic, with titles like The Invisible Women with Autism or What My Adult Autism Diagnosis Finally Explained. These stories told of women who spent years feeling different, misunderstood, and chronically overwhelmed before experiencing the relief of finally having an explanation." Maybe I'll ask you to sort of describe how you went from being in that spot where you felt this immense relief about having an autism diagnosis to where you are now, where you're saying, I actually don't even have autism.
Yeah, I mean, what I can say about that is, I've experienced a lot of changes and hopefully growth in the right direction over the course of my life. And 2019 was just a very different life that I was living. I mean, I was living alone in Los Angeles, had an apartment with my 2 cats. I was working from home. I was at this kind of point in my life where I was just kind of giving up on people or giving up on the idea that I would ever, get married or have kids. I kind of resigned myself to a life of just being alone. And uh, that was around the time that I started seeing all of these articles appear about women discovering they're on the autism spectrum. And they just sort of reconceptualized autism from something that I considered to be, I mean, people who had like profound difficulties, like visible disability, to just subtle presentations, many of the women you see sort of entering the autism category today. Like, there isn't anything noticeably wrong except that they're a little bit quirky and, have some difficulty socializing maybe. And I I thought maybe this can explain why I am the way I am, why I'm different, why I don't want the things that other people want. Uh, and it was very alluring to me. It seemed to fit my life. I mean, the way that it was described online, it was endorsed by experts, it was presented as a scientific breakthrough. All of these things just spoke to me, and I started to believe that I was autistic myself after researching all of the different traits about it.
So
And
how did you end up sort of making an appointment and going and trying to get your official diagnosis?
I had a therapist at the time, and they recommended I get an evaluation. And I knew that it would sort of include uh, input from my parents. So I had a long conversation with my parents, and I said, I think I'm autistic. And, they provided me with, they were open to the idea, I guess. They weren't like fully affirming of it. But, like, I think the first thing my mom said was like, well, on your first day of kindergarten, you, everyone, the kids went out to recess and you hid under the table. And I was like, yeah, well, maybe that's a sign that I was autistic. There was just so many things like that and so many stories like that. And just um, things that just seem to all send me in this one direction.
Can I ask, Christina, uh, sometimes the medical institutions get a bit of a bad rap for either potentially succumbing to the pressure of medical industry, whether it's big pharma or other institutions. But one of the things that I note a lot in my practice, and I'm sure Amy would attest, is that a lot of the time patients come with an expectation, whether it's for a formalized diagnosis or whether it's for some formalized treatment plan, whether it's a prescription, and we're equally being sort of pressured as clinicians to cater to what it is that their expectations or requests are. Do you find that there was how would you weigh those pressures at that time? Was all of this sort of self-reflection, your loved ones, your close circle? Was this largely from what you were experiencing and seeing online? Was there like a social pressure point of view? Did you feel that when you encountered the healthcare professionals, they came with an agenda as well?
Um, I wouldn't say in my particular case, I had a psychiatrist at the time, and I had proposed the evaluation to them, and then I don't know exactly what tool they used, but I think the conversation was about an hour, and it incorporated the conversation that I had with my parents. And but I do think that in like with this particular psychiatrist, and I've heard this happen with other people too, that I think that she sort of knew that the diagnosis would make me happy and
Mm-hmm.
was more inclined to confirm
Mm-hmm.
it. Um, when I think like kind of the sign of a good clinician and good doctor is to look for alternative explanations and to look for disconfirming evidence and to really carefully uh, evaluate the person. And I don't think that was really done in my case, because it took me a little while to realize later that some of the things that I had come to see as autistic were maybe better explained by other things, and that just was not part of the evaluation at all.
So since maybe not all of the audience has read your article yet, do you want to sort of go into what were some of the other explanations for what you thought was autism, but when you look back on your life, you think, oh, this was actually, these were the normal things I was experiencing, and I was able to sort of apply them to autism and go along with
Mhm.
that.
Yeah, autism's tricky because the criteria is broad and it just continues to broaden, and the way that it's talked about and the way that it's applied. And you have the core criteria, which are the social communication deficits, the restricted interests, the repetitive behavior. But I mean, each iteration of the DSM and the ICD, it just sort of expands a little bit further, and like, oh, now there's like 12 different criteria, but you only have to meet 6. And so what it looks like is a lot of different kinds of people finding themselves in this diagnosis, because it's very subjective and open to interpretation, I think. People can have communication difficulties through various different ways. But one of the things that I sort of interpreted as an objective sign was sensory processing sensitivity, high trait sensitivity. It has a few different names, but it was something I've always experienced. I was one of those kids who only ate mac and cheese or noodles with butter and wore stretchy clothes and hated having my hair brush. And then in adolescence, I was so overwhelmed going into um, middle school, where I'd gone from like a small elementary school to like a middle school with like a couple thousand kids. And I found it totally overwhelming. I would just hide from people. I mean, this is really when the depression started setting in. But I had never heard of sensory processing sensitivity outside of the context of autism, but apparently it's just something that, maybe 15 to 20% of people deal with to varying degrees. And I'm just one of those people, like, I can't go outside without a pair of sunglasses. I carry around earplugs if I am in an area that's very noisy and I need them sometime. Although I'm trying to rely on that less and just sort of like, just take it, just take the noise. um, but I think that might be one of the reasons why we're seeing so many women entering the autism category who might not really be autistic, whatever autism means at this point. It's hard to say. I mean, I don't I know that there are people who have like cognitive impairments and they're labeled autistic, and like I think that's an appropriate label for them, but as we just move further and further away from that and are just clumping all sorts of people together who don't have those cognitive impairments, it just conceptually loses a lot of clarity.
Yeah.
But I think that there's a lot of women out there who are sensitive to noise and light and other things like that, and they're just seeing themselves as autistic now because most people who associate that with autism, but it exists outside of the context of autism.
Right.
Yeah. One of the things that I have learned from different psychiatric mentors and even family practitioners who are really attuned to this is that we frame a lot of our therapies with respect to certain diagnoses when in actuality we should be considering just a profile of symptoms. And so if somebody
Yeah.
is suffering from anxiety, well, we have medications that can help with anxiety. That doesn't mean that you have generalized anxiety disorder or social phobia or agoraphobia or whatever the case might be. And I'm sure Amy can touch on this with her clinical experience as well. And so to your point, the consolidation of all of these traits into a single diagnosis that is now expanding more and more seems like bad medicine. I mean, like I think most
Yeah.
people who are objective looking at that would say that this is kind of like bad medicine. I took one of the take-home points that I took from reading your work, watching your interview on trigonometry, which I highly recommend if people want to go out and learn more. I think that was a remarkably impressive interview. Constantine and Francis are very good at that, but you were excellent there too. Is the sense of empowerment and self-improvement. It seems like whatever, I'm using deficits here, it's probably the wrong word, whatever limitations you feel like you had, you've managed to rise to the occasion and overcome them. And this was not necessarily through organized psychotherapy or organized dialectical behavioral therapy or something that might be used for people who have recognized, quote unquote, recognized disorders. What do you think is the role in self-help? What do you think is the role in personal reflection and insight versus the standard medical model of psychology, pharmacotherapy, and so on?
Yeah. Well, I sort of entered the, I guess, medical or psychiatric system when I was a teenager, when I experienced severe mental health crises, and that was where I was first introduced to the sort of biomedical explanation for psychiatric disorders. In my first appointment with a psychiatrist, I was told that I have depression and that it is the result of a chemical imbalance in my brain. And, we have medication to help correct the chemical imbalance. And ever since then, I just was constantly being assured through like neuroscientific terms and frameworks that, mental illness or whatever it was I was experiencing was the result of, a disordered brain disorder that I had no control over or ability to change. And that really affected my thought process and whether or not I could actually recover. And it was when I started, uh, shedding myself of those beliefs and realizing, like I'm not destined to a life of mental illness. I can overcome this. That, I did. I'm like extremely mentally healthy now. And that's something I sort of am concerned about in our culture today, is that there's a lot of people who are coming to see, the things that they're experiencing and their difficulties through this medical lens, and they're reaching for a psychiatric label to explain themselves without really realizing that sometimes that can limit you from overcoming your difficulties, and settle you in them, and just sort of take this attitude like, well, this is just the way that I am, and everybody should accept it, rather than, this is something that I struggle with, but I'm working on it. I'm going to overcome it. And it's not, clear and straightforward for every person, for every issue that they're dealing with. There's obviously people who have like profound disabilities and serious mental illness. But when we're talking about like the broader population, like you just increasingly are seeing more and more people flock to these diagnostic labels as a way to explain themselves, or even like build a brand on social media. You see that more and more. There's all TikTok subculture communities around different types of mental illnesses. And you just have to wonder, like, is this really healthy for these individual people or the broader culture? And I don't think so.
It's pretty crazy. And that's what I also partly found so fascinating about your story, is that in part your journey into becoming a journalist and sort of looking at the gender ideology and the medical scandal that is pediatric gender transition, and the way that youth were adopting a trans identity, you saw parallels there with what was going on with autism. And so that I think partly led you to wondering whether or not you were actually autistic. So I'm curious, and you talk about these TikTok cultures. I've seen the same communities. They have ones for like multiple personality disorder, which is a contested or dissociative identity disorder.
Or
They have it for Tourette's.
They're like performing their different identities, I guess. Which is that's just not how it works, to the extent that it is a real condition. Like that's just not how it would present. Like
Absolutely. And the underlying theme seems to be that people are adopting psychiatric diagnoses as their whole personhood, their whole identity. Maybe you can sort of talk to the way that you just sort of maybe incrementally how you saw the parallels between gender and the autism idea.
Well, the online activist community, that was noticeable right away to me, the similarities between how the neurodiversity community online acts with how the trans community online acts. They're both very like enmeshed with each other, and they both have this sort of like package belief, progressive beliefs where, if you don't adhere to them, they're going to let you know in the comments. I've witnessed this when I joined the community in 2019, where, if you don't hold the right views about autism as a sort of through the kind of social model of disability, then they let you know. Like they will scold you for not holding the right views. They will say that you're a bad person and you're ableist and you're promoting harm and you're harming the community, all of the things. That was pretty noticeable to me right away. So I kind of like slowly backed away from the wanting to be associated with the neurodiversity community. And I even became a critic of neurodiversity as a concept and the way that the community acts. But as I still retained the label Asperger's, because I thought that it really, described something about me that was real and was helpful for other people to understand. But it was in my work on, the trans issue and really getting into like psychiatry, critical psychiatry, uh, reading about the history of psychiatry and how, um, the book Saving Normal by Alan Francis, and how sometimes diagnoses were decided on by who was the loudest in the room. That whole thing, it really shook my faith in diagnostic labels that don't have a kind of objective medical basis. They were kind of decided on by a group of experts. And it's not that I don't think autism is a useful label to describe certain types of people. I just, I came to realize that it was just so conceptually weak that it's not useful for a lot of the people without any kind of cognitive impairments who are entering the category. And I decided to, reevaluate my own diagnosis experience and write about it so that other people could maybe reflect on their own.
Yes, I think that that's like arguably one of the most important take-home messages from your story is uh, my background was in neuroscience and psychology, and I remember talking about autism in 2005, 2006, 2007, and I remember a professor talking to me about, quote unquote, it was previously labeled as a super male syndrome, that the
Mhm.
preponderance was like far, far more likely to be in men, and like RFK Jr. has cited many, many times the best studies. I think that I want to say you probably know better than me, Christina, that was like out of Idaho and tracking these very severe levels of autism and how that has increased over time. But then you look at the overwhelming number of new diagnoses. And I have several family members who are very close to me who have, I would say, moderate to severe autism. And they have very obvious, overt characteristics that are uniform, that are consistent. And you look at other people who come in and will say things like, oh, well, I'm on the spectrum. And they are extremely high functioning. They don't seem to have a whole lot of deficits, but they have a particular anxiety or a particular dependency on the diagnosis as part of their identity. Do you think that this is mostly fostered from an advocacy point of view, an activism point of view? Do you think that, let's say autism organizations, the more members they have, the more funding they receive, and so on, that there's like an incentive that way? Do you think that this is mostly a tribalism thing, like a normal human psychology where people band together and are protective over their identities and protective over their communities? What are the forces that you think are influencing the influence in society for adopting these kinds of diagnoses?
Well, activism has definitely infiltrated the research side of things, and what the organizations that represent autism now focus on. They've been subjected to like numerous pressure campaigns. Like Autism Speaks, for example, is regarded in the autism online community as like a genocidal organization because for a very long time that they had a approach to autism that was more oriented around the medical model, which is this is a disorder, we want to find a debilitating disorder, we want to find a cure. And you have a lot of, adults now entering the autism category without impairments who say, you want to kill us all. Like they're
Right.
very unhinged arguments that don't, you know, take into consideration that it is of extremely debilitating disorder for a lot of families that, um, and
It's one of the things that, to your point, that always struck me is that, by in a sense cheapening the severity or the significance of the diagnosis, it actually does a major disservice to those people who are, like full throated, let's say, right? Like the ones who are in the severe category, to have autism diluted with all the range of people. And it's one of the reasons why I actually really found your argument compelling about the maintenance of the term Asperger syndrome, despite the negative connotations associated with Asperger and whatever the case of his background was. I actually think that there's a very strong reason to keep a sort of a brighter line in between these
Yeah.
categorizations. That way it's much more protective. And we see the same thing when it comes to gender ideology, right? I mean, like, there are some people out there who very sincerely, I remember a time when you had to live in the opposite sex for a year before somebody would engage with you to talk to you about
Yeah.
any kind of gender affirming care. And then that got cheapened and cheapened and cheapened, and all of a sudden it's a genuflection for anybody who's slightly boyish when they're female or slightly femme when they are boy. And so,
Yeah.
to your point, is that those categories actually play a major role in society by protecting those who actually fit in those categories proper.
Yeah, and some of the major, most prominent autism researchers too, like you can see them, endorsing gender ideology as well, and doing papers on the trans autism overlap, and just fully endorsing all the activist beliefs that come with trans. And it's been really disappointing. It's like, how do I trust anything that you've put out in the past? And you're one of the most prominent
Yeah.
researchers on this issue, and your ideas about it have shaped millions of other people's. And I just don't know what even to think about that anymore.
So just over a year ago, I think you were on the Trigonometry podcast. You were
It was
talking
like
about the
2 years.
Oh, was it 2 years ago? Sorry.
I think
Okay.
so.
You talked about the overrepresentation of autism among young transgender identified females. So I'm curious if your sort of
Mhm.
recent revelation about your own autism diagnosis has changed the way that you think about these females that have both an autism and a trans diagnosis. Do you think that a lot of the sort of transitioning females that have been caught up in this ideology have also been caught up in this false autism diagnosis?
Yeah, I at the time was hired by an organization to write this really lengthy report on the overlap between trans and autism, and my view was that, well, trans as like an actual innate mutable condition I know doesn't exist. Maybe what is happening is you have all of these, primarily young women who think that they're trans. Maybe they're actually autistic, and because I saw a lot of similarities and between some of the symptoms, like for example, um, with autistic girls, it's said like they get along better with boys sometimes rather than other girls their age, because other girls are very cliquey and they don't understand the social rules, and boys are just generally easier to be around and less judgmental. And I thought, well, that's one way that a young girl who maybe is autistic could mistake that for a sign that they're transgender. So that was really what the report was about. It was kind of an exploration, and I did a survey where I administered the autism spectrum quotient to a group of young people who were either who were detransitioned or who had desisted. So not all of them had medically transitioned, and of course, like there were a lot of them who scored high on the autism spectrum quotient, but is it really that reliable a tool? It's kind of just, it can pick up certain things that they have, uh, certain things about themselves, but I don't really think it can help us uh, call them autistic.
Yeah.
So it's, on the one hand, like autism is a better way to identify than trans because it doesn't involve all of the medical interventions. So, but, you know, it obviously has its drawbacks too. And my hope is to help people look less to psychiatric diagnoses and more towards overcoming whatever difficulties they're having, and
Yeah.
being healthy and not really identifying so much with illness.
Yeah.
I think that's
I
a great
noted
message. Go ahead, Amy, please.
It is.
Yeah, I think
It
it's a
is a
great
great
message.
message. Yeah. I noted these crossovers when you're talking about the activism for autism, and they mention, parents that are trying to get treatment to help like profoundly autistic kids that are severely affected and having difficulty socializing and having a normal childhood. And the parents that are trying to get them help, they're sort of being attacked by these activists in the autism community, and they go so far as to accuse people of eugenics. And that's the same language that we've also seen
Mhm.
in trans activism. They'll accuse persons of who don't want to transition minors of engaging in eugenics. It also happens in fat activism, where, believe it or not, people have accused persons who've gone on Ozempic or who have had weight loss surgeries of participating in eugenics. It's like the same sort of these activists, they all have something in common and they're using the same language.
Yeah.
And I guess I'm also really curious, like after this article came out, it went pretty viral. What has the community done to you? Are they attacking you right now? What's going on there?
It did go viral across many different platforms, including like Blue Sky and Instagram, and I think Reddit, and obviously like on X. I didn't read all of them. I think some of them were just entertaining to me. Like they're doing the detransition playbook, but for autism was like some of those posts went more viral than my own. Um, I mean, yeah, I mean, I'm glad people are seeing the similarities between them because they're both very much influenced by social contagion. Um, there's been a few people who have really just latched on and made like series of videos about me, weird stuff like that. I just don't respond to them because they're mentally unwell, and you never want to give those people the time of day because then they'll just fixate on you more and spiral. And but it's crazy the like weird theories people come up about you.
I
But overall the response was good, and I really hope that like some of those autism researchers see what they've unleashed.
Yeah.
I see oftentimes there's like cookie cutter ideas of what people will expect from other people in society, and it's increasingly homogenization within these certain niches. So one example is like in med school, I was part of the admissions committee for Dalhousie for quite a while. And, one of the things that we're always trying to guard against is the idea that everyone has to be outgoing, everyone has to be socially confident. There's all these kinds of sort of soft rules where taller individuals tend to get more accepted into medicine because they seem to air a lot more confidence in interview settings, and people who are captains of their team, people who are always engaged in high social demand activities tend to be preferred, as opposed to the quiet introvert who likes to sit and read, or the person who likes to spend more time in their own head gardening, and those kinds of things. One of the things that I love about your story is that it takes all kinds of people to make a society really rich. Do you feel like there were people in your world who were like, you know what, Christina, actually, I think that you are absolutely wonderful the way that you are. And I don't think that anything like this is necessary. You shouldn't be pursuing any kind of treatment, diagnosis, therapy, or anything along those lines. Or did you find that there were particular people along your journey who already had the inclination to push back against this kind of pressure? And who were they, and what were their backgrounds? What made them different from the norm?
Uh, are we talking about like when I first was diagnosed and like announced that to people?
Yeah, yeah, but even sort of like now that you are rejecting it, do you find that there's like a type of person or a class of people who are like, great, good job, Christina. I'm glad that you are coming to this perspective and have sort of encouraged that. Like I wonder, did you find something in the spiritual realm? Did you find something in some a particular faith practice, or did you find it in, for example, a bunch of exercise programs? Was this more common in a gym setting? I just wonder, what is the kind of person who would be naturally attuned to pushing back against these kinds of more subjective diagnoses?
Uh, well, definitely the parents of youth who have severe disabilities. I think
Mm-hmm.
they've been, the first ones to be pushed back and say like, hey, like my child has significant impairments. He needs these types of therapies. If we don't help him control his behavior, um, you know, he's not going to be able to function later in life. They're definitely the first ones to notice the problems with the neurodiversity community. Uh, but more generally speaking, I guess people who lean right
Yeah.
are more skeptical of some of these diagnosis narratives. Obviously, like once you see the similarities between the autism and the trans issue, it's hard to unsee that. Like it just they all kind of move together in the same direction, just towards just ever expanding more and more people entering the category.
Yeah.
I think it's interesting that you also wrote in your article that you had worked when you were younger um, as a special needs caregiver. And, of course, like Dr. Lavranos and I, we both have medical and nursing backgrounds. So we've all seen profound disability, including people who are profoundly autistic. And I don't think that the general population understands what that can look like. Like
Mhm.
maybe some people do if they have a child, especially in Canada, because we have a lot of social supports for profoundly autistic children to allow them to be in regular classrooms, and they'll sort of have support persons with them. And so our kids might be exposed to profound disabilities in that way. But I think a lot of people still don't really understand, like if somebody is profoundly autistic, that is it it is so life-changing for entire communities and families. And the notion that sort of what you talked about, like a quirky personality can go and adopt this label, and it is just worlds apart from the profound disability. So I think it's really interesting that that's also something that you saw, and I'm sure it really informed your journey moving
Yeah.
away from this label.
Yeah. I mean, definitely. I worked as a special needs caregiver for many different families and different conditions who had, very, very disabled, very extreme impairments. And it's, you know, as a respite caregiver, I was in their home able to offer them, like 4 to 5 hours at a time for them to take a break because it's a full-time job. Like it's a 24/7 full-time job. Like one of the parents is usually their full-time caregiver. Uh, and I don't think many of the activists or the adults entering the category today really have any experience or knowledge about that. Otherwise, I just don't think they'd be saying what they're saying and advocating for what they're advocating for.
One of my thoughts on
Speaking
that
of,
is that there's us. I remember a time where people didn't use these kinds of diagnoses and the subsequent identity as a positive, and I wonder if there's a sense of like we're losing in society a sense of resilience. Like one thing that comes to mind when we're talking about this sort of TikTok culture is a person I know who is quite a successful individual has embraced their diagnosis of borderline personality disorder and has an entire TikTok following associated with their life as a successful person managing this disorder. And when I think about that, and I often will discuss such a topic with friends of mine, they'll be like, I mean, it's good to embrace a pathology. It's good to talk about it so that you can normalize people pursuing treatment and self improvement. But on the other hand, where was the sense of shame about, like maybe you shouldn't be advertising something like that. Maybe you should be dealing with it and recognizing that it's your cross to bear and being a little bit more stoic or reserved. What do you think about the balance between those, between sort of like highlighting a quote unquote disability, whether it's more subjective or more objective, versus the victimhood totem pole and how you use or abuse it in society to get leverage?
yeah, I think there's definitely been this movement to destigmatize mental illnesses, and I think that it's had negative effects uh, to the point where you see people just glamorizing various different types of disorders and just living in them without really considering them as something like this is, these are some of the challenges I have that I'm working on overcoming. Like we mentioned before, people creating, brand identities around their diagnosis that can be very unhelpful. But sorry, I lost track of the question.
I guess just how do you sort of balance between those two? Or, like in your experience with what you've seen, is it, has the pendulum swung too far? Is it ultimately a net force for good by embracing these things and destigmatizing them? How do we find that balance in society?
Yeah, destigmatization has been, part of this kind of like public health approach to mental illness that, state and like national policy have been working towards, and it really doesn't help anybody. It doesn't help the people who do have serious mental illness, and it doesn't help the broader population who are continuing to see themselves as having some kind of disorder.
Something that I like, something I've seen you talk about this a lot is the idea of an external locus of control versus internal locus of control. And I love that you regularly post about this because you kind of suggest to people it's in your power to be able to change your life and to be able to work towards being sort of the best version of yourself and achieving your goals. And if you just embrace these identities and diagnoses, you are assuming that you're powerless to kind of change yourself. And so I think we have such a dearth of people actually going out there and saying that. I worked in psychiatry for years as a nurse, and I found that when I started, that was sort of what we would tell patients is you're able, if you work hard, you can overcome, you can be resilient. And it sort of moved towards this model of, it was often called trauma-informed care. And the sort of the premise there is like, everybody has trauma, everybody's broken, people might not even want to talk about it. And it's sort of the opposite of resilience. And I think when you would, this is the same thing that's happening when people just embrace a diagnosis. They're like, well, it's something that happened to me. I'm powerless. And I think I see a lot of parallels with your story too. And I think you also fell into this sort of medical system that just does this to people. It just sort of steamrolls people and makes them feel like you are your whole self is the sum total of a diagnosis. I think it's so wrong.
Yeah, I think that in our culture, people are just bombarded with explanations that de-emphasize their agency and offer a kind of external locus of control. And you see that in the biomedical explanations of psychiatric disorders. You see it from out of the humanities and social justice identity politics. The world is working against you because of your race or your abilities or your sex or gender identity, all of these things, and so many more ways. But in particular with the biomedical explanations of what you're experiencing, psychiatric difficulties, they're very alluring because they're kind of a way for you to explain away all of your past mistakes and your bad choices and your bad habits and say like, well, I can't help myself. I have this disorder. I have this condition. Like this explains why I do the things that I do. And instead of taking more responsibility for them, and that made the autism diagnosis for me kind of reframed a lot of my bad decisions and things that happened to me when I was younger, as it made them feel more like they were inevitable rather than something I had the power to choose differently over. And it helped, reduce a lot of the shame that I felt. But I think it's more important now to speak out against those narratives that de-emphasize agency. I think society and culture is headed in a bad direction if we continue down that pathway. And I would like to, whenever possible, talk about the differences between internal locus of control and external. I mean, you see in research has been consistent on this. People who have an external locus of control and think that, things happen to them outside of their control and they don't have, they tend to have worse mental health. And it definitely also correlates too with political ideology, where you see liberal women in particular, and those who have latched onto these narratives that orient them around an external locus of control, they tend to have more mental illnesses. I think there's something to learn from that.
Yeah, I love that. So, I mean, this speaks to me a little bit about a certain stoicism, right? That you have control over what
Yes,
you do and not
Yeah.
the outside
that
world.
helped
And we're
me a
talking about,
lot learning about
yeah,
stoicism.
yeah,
Yeah.
and I'm sure like classical Marcus Aurelius stoicism, not
Yeah.
Nouveau Ryan Holiday stoicism. Um, so one of the things that I wanted to bring up was exactly on that front. You are doing very well, and you are like obviously lovely and charming.
Oh,
Um, l-
I don't know.
l-
Thanks.
Oh, you're most
It's
welcome.
true. It's true.
It is true, absolutely. I would like to say, both as a physician and a lawyer, it's my duty not to lie. I have to be honest. um, but let's just say that you felt like this diagnosis was doing you harm. You wanted to escape from the identity that's associated with it, and you had gone to counseling. I don't know if that is the case or if that is not the case. In Canada, we have a law against any form of what is titled conversion therapy.
Oh,
Um,
yeah.
Conversion therapy is, from a law point of view, extremely, extremely broad. It encapsulates anything that's not basically affirming. And so there are problems with the definition of conversion therapy in and of itself. But on a policy, on a pragmatic point of view, what do you think the role is for someone, like a devout Muslim, a devout Christian who feels like they have homosexual inclinations, seeing someone to talk to about it, or conversely, someone who has a diagnosis of gender dysphoria who wants to go to someone and talk about, well, I don't want to be a woman, and uh, finding someone who psychologically in psychotherapy would go against the grain. What do you feel is the role for formalized supporting of that kind of process versus personal pursuit? So, would you approach someone to talk to them about your psychological concerns about identity, or do you think it is best placed to be done internally? I mean, that's the sort of external versus internal locus of control. I mean, like in a sense, because you're offloading some of the responsibility to going through it with someone, but ultimately it is you who is changing.
Yeah. And are you saying like should someone who feels like whatever it is they're experiencing seek outside help from therapists and psychiatrists to confirm for them or seek the answer within?
Yeah, yeah, in its sort of biggest scope, but I'm thinking a lot more specifically about the idea that it would be against the medical grain. So instead of somebody saying, "Oh, you know what? I feel as though I have gender identity disorder, and I, Aris Lavranos, want to become a woman," finding a psychologist to help me go through that process is actually today very easy. In Canada, finding somebody who will help you sort through that, let's say objectively, or to be reluctant down that trend, is basically illegal. And so,
Mhm.
from a formalized psychological therapy point of view, what do you think the role is for somebody rebutting against these ideas or challenging a patient with those inclinations?
Well, I definitely don't think that the role of the medical professional, clinician, therapist, psychologist, psychiatrist, their role shouldn't just be to affirm what the person believes about themselves, but I mean, you'd want to be supportive, but you'd probably want to sort of challenge them on some of their beliefs. I think, a lot of people enter the profession because they care about people and want to help them and want them to make them feel better. And I encounter this a lot in my work on like youth mental health policy that sometimes what you're offering to them in the short term can be bad for them in the long term. So you might be affirming them and making them feel good about themselves in the short term, but it can have long term negative consequences. And you have to take into consideration what is best for the person rather than, affirming their desires and wishes.
Do you think the
Isn't it
government has a
funny?
role for that? Sorry, Amy, I want to flush that out. Do you
Yeah,
feel
yeah,
like
go for it.
like would you criticize a government for weighing in on such a matter, or do you think that there are policy considerations where, banning conversion therapy for homosexuality is appropriate for government? Like where do you think the policy line should be drawn, and what factors do you think a government, because like in Canada, like famously, our conservative leader, Pierre, who I strongly support and endorse, voted in favor of a ban on conversion therapy. And
Yeah.
that's the kind of nature of the question that I'm hoping to get from you.
Yeah, I mean, conversion therapy was a lot different in the past than what it is today. And when people think about it, they think of, like hurting people who are gay and trying to, with the various different methods they used in the past. Brain shocking them or something like that. I don't know. I don't recall all of the details, but people have that association with conversion therapy when they think about what's happening in the therapist's office today, which is, just challenging someone on
Right.
some of the assumptions they've come to about themselves. And the United States has that policy in various different states as well, where they've banned conversion therapy for sexual orientation and gender identity. It's obviously wrong. Gender identity and sexual orientation are wildly different things. And there's also maybe an incentive for more people today to enter to say that they're gay too. I think that, or bisexual or something like that. I think, it's like a quarter of Gen Z considers themselves to be LGBTQ or something like that, and it
Yeah.
seems very unnatural. So it wouldn't surprise me if that was people were identifying as gay who weren't really, because it is very socially advantageous to have an LGBTQ identity today in the culture. But that is, I don't think that our laws should be banning conversion therapy.
Yeah.
As
Yeah. Right
it's
on.
currently understood, but
It's tricky,
obviously,
especially the conflation of sexual orientation and gender identity is what I think partially allows these laws to get passed, is because people historically look at what happened to gay persons who went through these horrible sort of abusive processes to try to make them not same-sex attracted. And of course that was terrible. And then these trans activists come along and conflate what a therapist might just say, hey, why do you feel distressed about your body and your gender? And they're conflating those two things. And one is terrible, and the other one is just sort of the normal, what you talk about. Like if a patient comes to you, you shouldn't immediately affirm them in whatever they want as a diagnosis or what they say they're feeling. You should challenge them. And I think it's interesting because I've noticed in psychiatry that there is a lot of sort of kowtowing to what people would like as a diagnosis, but where that doesn't happen is with psychosis and with schizophrenia and or even profound autism. Like if it's so obvious that someone has such a significant and horrible disease, it's just, it speaks for itself, and nobody is celebrating that as an identity. It's only in sort of these mild cases where someone is like, oh, look at me, I'm depressed, I'm anxious, or I'm autistic, but they're able to go and make a TikTok account about it, and then they end up being celebrated. And I guess the common denominator is when it's someone's identity. And I think our culture is just so obsessed with these identity labels. And it's it has infiltrated our medical system to the point that it is harming the population as a whole.
Definitely. I'm glad you brought up serious mental illness as well. I think it's very helpful and useful to see people discussing, the weaknesses of psychiatric labels and psychiatric care, and medication and things like that for people who don't need it. But it can obscure the fact that, there are people out there who really do need it, who need a diagnosis for insurance reasons and who need medication to help control their psychotic episodes, and sometimes long-term care, which is an issue that I work on with youth with severe mental health issues and long-term treatment. But I'm glad that more people seem to be discussing this focus on over-identifying with psychiatric labels who may not really need them. And that was, when I was growing up, I was too focused on identity and a little too introspective and self-critical and looking for various different frameworks to explain myself, and focused a lot less on things that I could have done for myself to make myself proud and lift my self-esteem like I have today. Like, it was becoming a journalist and, making accomplishments and things that make me feel proud about myself. Like, I think that's done the most for my self-worth, and my entire life, where I feel like I am, making a contribution in my small way to society, and instead of retreating from it. But introspection is a good value, but there is such a thing as too much of it, and sometimes you need to stop looking inward so much and start doing things.
Yeah. And congratulations, by the way, on your recent engagement, which I forgot to say at the beginning. But
congratulations. That is lovely.
Yeah. You're so right that people, and when I talk about the way that this is harming our culture, I think it's in just that way, is that it suppresses people's ability to achieve what they can in their lives, because they just go, well, this is who I am, and was the hand that was dealt to me, and I can't be any better than this. And that's just so wrong. Maybe, oh, go ahead.
Oh, and like I that definitely happened for me when I did identify myself as autistic or having Asperger's, is I kind of used it as an excuse to not work on my social skills, like just and without even really realizing that there was room for improvement. I didn't really see that I could improve. And it wasn't until I had a job where I was doing really heavy reporting and journalism, where I had to just cold call people and get them to tell me things over the phone and information that I needed, that I realized I'm a lot better at communicating than I thought once the right incentives are in place and once the right motivations are there. I can handle it pretty well. And that was one of the other major reasons that made me realize I probably am not autistic if I don't have some kind of innate communication deficit. And it's something that is, like socializing is a skill that you have to develop. And inexperience with socializing can mimic a lot of the symptoms associated with the communication deficits with autism. Like,
totally.
I took things literally. I didn't laugh at other people's jokes. Just things like that, where, the more you communicate with people and the more social experiences you have, you learn from those, and you learn to catch it next time. That was just, I focused on the social component too on in my article, but there's a lot more to to sort through with the diagnosis.
Yeah. I wanted to say that I thought you posted recently on X a lovely little video of you and your fiance building a frog pond, and that was so cute. Usually at the end of our episodes, we talk about a lot of really heavy subject matter here, and we often will conclude with a moment of levity. And what was the prompt for that? What was it that you guys were? Do you have frogs? Is that something that you guys had thought about for a while?
Oh, we moved into a house in Tennessee a couple years ago, and the previous owners didn't take care of the pool. So we have all these frogs around who would lay eggs in the pool. And when we acquired the house,
Beautiful.
Colin wanted to take care of the pool and put chlorine in it and get it back up and running. So I had to, scoop out all of the eggs and transfer them. I had bought these tubs from Tractor Supply, these like 50-gallon tubs, and I had this whole operation going for the last few years where I have like 3 of them going, trying to raise these little frog eggs into tadpoles, into froglets. And I finally said this year we are getting an in-ground pond so that they have an alternative place to lay their eggs. And it's full of tadpoles right now, so I'm
That's
happy about
awesome.
that.
That's awesome. I love that so much.
Oh,
That's
thanks.
beautiful. And it's funny, I do the same thing. I grow frogs in my backyard
Yeah,
too.
yeah, you should really. They have these. I think I held off before because the plastic tubs were like $400 or something like that, and they have one right now from Lowe's. It's 125 gallons. The plastic's a little thinner, so we'll see how that holds up. But it was something like $150, and I thought, like, that's
Oh,
reasonable.
wow.
I just need to get Colin to dig a hole for me. He did so much work on it, and I'm just so
Yeah.
That's
glad,
Oh,
lovely.
that's
so
lovely.
grateful that he would help me
If
make
you
my frog pond dreams come true.
if you build it, frogs will come.
Yes.
I have frogs in the house and in the yard.
Oh, really? I
Yeah.
I I have some that were born just so late in the season last year that they never transformed and they were going to die and freeze
Aw.
over winter. So I brought the tadpoles inside, they transformed into froglets, and then I released them once we had the pond all set up. What kind of frog is it?
It's a Brazilian frog. It's called Pac-Man frog. And it's
Oh, yeah.
it has teeth. I think it's the only species that actually has teeth.
Those are cute.
And I also have Pacific tree frogs in the yard, and then I bring a couple in the house. I ended up
Mhm.
releasing them last winter because they kept trying to hibernate inside the house, and I'm like, oh, these frogs are gonna die, so I gotta let them go and hibernate outside.
You've shared pictures before, and they look very similar to what we have. The gray tree frogs. They're really cool. They change colors.
Yeah, they
That's
can go
the
from bright green to gray.
and that's the species I think that's most common over here. And I just love them. I love their croaking during the summer to listen to them.
Yeah.
I had there was this cartoon that I grew up watching, and this is like another sort of thing where I sort of considered it a sign of autism, I guess, because I would just watch it on repeat. Like I wasn't interested in watching anything else. Just when we had VHSs, it would rewind automatically and come out, and you just push it right back in. And I did that as a toddler. It was called Rupert and the Frog Song. I don't know if you know it,
Aw,
but Paul McCartney uh, was involved with it and wrote the song for it. It's really
That's so
cute.
cute.
I highly
Yeah.
recommend it. But yeah, I mean,
I'll
I've
check it
always
out.
it's my
Christina,
own personal pond.
I'm so grateful for you taking the time to talk to us about your journey, your insights, both from like an individual, from a systemic, from a medical industry, policy level. I think that you are fighting a really, really good fight. One of the theses of the firm and sort of like my personal missions is to encourage a certain skepticism in the individual when they approach the medical establishment. That it is wrong to think of them as all knowing, and
Mhm.
that just like any other human institution, they make lots of mistakes all the time. That no one can be a better advocate than you yourself, and so people should approach with a certain skepticism. A lot of the times, patients will say to me, "Oh, I googled this before I came," or "Oh, I chat GPT this before I came," and I'm like, "You should not be ashamed of doing that. Why would you possibly say that with any sense of shame? Like if
Yeah.
I'm going into a lawyer's office, if I'm going to court, if I'm going to see a doctor, I'm going to do the same thing too. Why wouldn't I?" So you
There's
should
like
embrace those.
there's this bias on the left against doing your own research. Like, no, you should definitely do your own research, but
Yeah,
learn how to do it correctly. Is
yeah.
That's important.
And it's the second time that you mentioned the left-right divide, and your own. I'm familiar with your own personal story about sort of like drifting more rightward over time.
Mhm.
Um, I think about that a lot because the pendulum has swung too far. And so a lot of the sort of evils that we see in society is because society is not in balance between the left and the right anymore, especially with these large scale influential institutions that are like totally controlled by leftist thought, whether it is victimhood, whether it is the loss of personal agency, whether it is a hierarchy of victims. There's so much embedded Marxism in society that's the problem. But one of the things that I often think about is that, like Jonathan Haidt did some great research on why that's the case, and like this preponderance on the virtue of compassion. And I'm really glad because the nature of our conversation today highlights that it's not that our perspective or that right-leaning perspective is lacking compassion. Actually, for those of if you want good things to happen to your trans neighbors, you should have a skepticism with gender affirming care. If you
Mhm.
want good things to happen to your friends who are neurodivergent, quote unquote, you should have a certain skepticism for DSM, for ICD diagnoses. And so the compassion is not limited to the left, despite the fact that they put a preponderance of their emphasis on compassion as the holy virtue.
Right, and that's been my experience, working as a journalist on various different policy issues. Like the progressive policy thinking often comes from a place of compassion, but it's often misplaced and misguided and oriented around uh, a sort of uh, aspirational or idealistic view of human nature rather than a realistic one. And they end up designing policies across many different areas that end up doing more harm than good, where they focus too much on like the short term benefits without really realizing how they have the long term consequences, things like that. And you see it across so many different policy areas. That's really what has resulted in my kind of gradual shift rightward is the kind of underlying ideology across so many different areas that they get wrong.
Right. Right. Well, I'm so grateful. Thank you so much for joining us today. I hope you'll come back in the future and we can talk some more about the work that you do. And society is very grateful for the work that you've done so far because, you may not appreciate it, but like, for example, your trigonometry podcast is something that I will refer to regularly. You
Oh,
have a tremendous amount of data and information, and you have a real granular appreciation for a lot of issues. And that's what emboldens everyone in the influencing world to sort of be like, yeah, you know what, I am on the right track because people like Christina, who have done the deep dive and the work, are on the same side. So I really thank you for the work that you've done.
and
Yeah,
thank you so
thank
much
you.
for having me. And I'm really glad that you're doing this podcast. It's very needed to have these conversations that are very thoughtful around diagnosis and identity.
Thank you
Thanks.
so much for coming on.
My friends, let us consider that acuity is the refined clarity of thought and perception which enables one to discern subtle truths.